The physical activity components of Project Hero are really very important because we know as young people move, they are learning. Their learning is characterised by a concept called embodied cognition. They're adapting their brain so that when they go to an active learning scenario, they're in a better place to learn. That makes it hugely important for affecting the tone of their behaviour in class and in school.
The idea of a health mentor being in school for the whole week means that he can build relationships with staff and with children so that the impact is more prolonged and more meaningful.
He's a positive male role model within the school as well. A very popular member of staff now in the staff room and around school.
We had the vision really for developing the dinner time when the children have time freely to play as an opportunity to structure it and give them wider opportunities. So we have employed sports coaches to do that at lunchtime, and really the health mentor role has developed from that initiative.
Firstly, it makes perfect financial sense to have Des here full-time, making a positive impact throughout the whole of the school and not just one specific area.
Having a health mentor in school throughout the day, it makes a massive difference from just going in as your lunchtime or mornings or after school, because they only get to see you for an hour, if that.
Des works across many areas of the school, so he doesn't just give us a PE teacher, for example, and his background outside of the education sector means that he brings an awful lot of expertise that we haven't previously had.
It's had a massive impact already. He's working alongside some of our existing support staff, working with specific groups of children to help develop a more active and healthy lifestyle.
I thrive on meeting out-of-the-box people who are prepared to do things, action-centred development, and that's exactly what Evolve is trying to do.
In relation to education, the experience that we've had when talking to head teachers and classroom teachers, which is kind of probably what we'd expect if it was rolled out more widely, is that this is going to affect your school climate because it's very helpful for disruptive pupils, for their disruption to be lowered so that classrooms become much more functional, more purposeful environment for teachers to do better, so the fatigue factors, burnout, the teachers much reduced. This makes schools much more functional units. The major impressions that I'm left with from the data really relate to this idea of school environment or tone, how helping unintentionally disruptive pupils can become part of the mainstream school experience and to really start enjoying the school experience. And the value of that is that the teachers don't have to deploy so much attention to those pupils, which means they can deploy their attention to more of the beneficial things of the school experience. And that's hugely important for making schools work better. It's not one child getting better, it's all the children in the school getting better and the teachers enjoying being in the school better. That's really vital.
I see no reason as to why there shouldn't be a health mentor in every school across the country. They offer a fantastic service, they have real outcomes with real children who need it the most.